chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code AgelessHealth and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Ageless Health live stream. I have another great program for you today and an amazing, amazing guest. We're going to be talking about something that is in the chat around the whole medical community, has been now for several years, but becoming more aware, if you will. And we're going to talk about something called peptides and how that works in your body. And it's the restorative function of virtually everything that takes place. It's a triggering mechanism for multiple pieces of the body. We're going to find out from a specialist, a very dear friend, Dr. Shannon Ginnan, who is an amazing medical physician. Known him for quite a few years now. And I really, really applaud his capacity to come into our arena and do what we do, and digs deep and understands it, and really is a consultant to me on back door. We sit and we talk to each other on a lot of different things, and I pick his brain because there's so much there to pick out. It's amazing. But anyway, having said that, Dr. Shannon, welcome to the program. Love to have you here today.
Thank you. It feels great to be here with you, and thank you for that very generous introduction.
Well, telling things are the truth are easy. It's it's the stuff that you have to lie about, that you have to tell a story about. But nevertheless, that was an easy intro for me. Let's we're going to talk about a couple things that you have been involved in for quite a long period of time. About. We're adding it to our practice in a couple of different forms. This year is going to be an interesting expansion at the Roselle Center in Fairfax. We're going to be adding some peptides. We're going to be doing some exosomes. We're going to be doing IV drips in a functional medicine model and bringing in the people around it. And that'll happen within the next few months. Flying out to Utah in a few weeks to meet with a research laboratory that is very cutting edge on some of this thing that we're going to be talking about today. But having said that, let's get into the program, because I really want to kind of pick that brain of yours again. And not only that, but let our audience know who you are and so forth. You've been in practice as a physician. I know right now you're doing consulting more than you're doing hands-on, and you're part of a research group with Dr. Pete and so forth. But what's your background, and how did you end up where you're at right now, considering, and I say this with ultimate respect to you, is, you left the tiger's cage, or if I want to be really straight on what I want to say, the snake pit, because, and really answering the question about people's health is why, where did it come from? How did it start? That sort of thing. So how does that bring you to where we are today? A guy who is amazing relative to what we do and how we do. Walk us through that a little bit.
Okay. Well, took a pretty circuitous route to get here. I can't say that really any of it was planned. Some people have a master plan. I don't. When I went into, actually, as I was in pre-med in undergrad, I was thinking, I was going to be a physician. Everything I did was for, the goal of getting into medical school. In my freshman year, I ended up being misdiagnosed with recurring sinus infections, where they put me on antibiotics for rounds of 2 to 4 weeks at a time for 7 rounds. And I would feel better. And then, I was in college. I'd go out, with my friends and party. And the next day I would be like, oh, I'm just trashed. And I'd go back into the health office and they'd say, oh, you've got another sinus infection. Here's another couple of weeks of antibiotics. I had no idea what that really meant at the time. Of course, now I do. That destroyed my gut, but that also led to having chronic fatigue syndrome. So I went through all of undergrad, averaging about 12, 14, 16 hours of sleep a day. Made school a little bit difficult. And I went to many doctors, and none of them had a reason for why I was feeling so poorly, other than my primary care doc said, well, you're probably just depressed. Here's an antidepressant. And I was kind of like, well, of course I'm depressed. I used to, go to a 2-hour football practice, leave there, go to 2 hours of martial arts, go home, do my homework, and then go out with my friends in the evening. Who wouldn't be depressed if now I'm sleeping 14 hours a day? So there really wasn't an answer for me. So I kind of that sort of put me off of medicine before I even got there. And then when I got into medical school, I still had the issue with the fatigue. So the volume of information that you have to take in there is it's impressive. And again, when you're very tired and you're sleeping a lot, it becomes very difficult. So I ended up actually taking a year off. Medical school is kind of broken into 2 phases. Your first 2 years are really just all book work, and your second 2 years are all clinical. So after the book work, I took a year off, looked up different herbs that might be able to help me, and did as many kind of formulations as I could for fatigue. And when I got back to start the 3rd year, I had gotten myself well enough to be able to, do the rounds with the physicians and the different things that we had to do. And I was actually considering not even coming back. And my friends were saying to me, oh, come on, first 2 years suck. It's so much better when you get into 3rd and 4th year and you're doing clinicals, and you'll enjoy it a lot. And I said, okay, and these were guys that I was really good friends with, and I had great trust with them. And so that's what I thought how it was going to go when I came back. And as I continued with medical school in the 3rd and 4th year, I just kind of became a little bit more and more disgruntled as I was on the wards and, rounding from patient to patient to patient. All I saw were people that we were patching up to get out of the hospital as quickly as we possibly could. And then so many of them were just coming back a week, 2 weeks, a month later with the same problem, and we weren't helping anybody. All we were doing was managing their decline. So that that was very difficult for me. I felt like, what am I doing here? So I did my required internship and got licensed, and thought, I just need to do something completely different. This is not going to make my soul sing, let's say. So I looked for different routes, in things that I could do with my medical degree, and initially found a growing med spa here. And so what brought me down here to the DC area was in upstate New York. And I became a medical director for this growing med spa, doing aesthetic things for many, many years. And the focus was on, laser hair removal and, Botox and dermal filler injections and, things like that. So it was kind of sort of half business, half clinical in that arena, and oversight of a large group of staff. So I did that for a while. And then the med spa, they sort of, in their desire to sort of increase their services, said, hey, we want to get into weight loss. We want to be cutting edge. How can we do this? And so I was looking around, and I found A4M, the American Academy of Anti-Aging and Regenerative Medicine. And I said, well, I looked at the curriculum and thought, well, this could be very interesting. And I went to my first weekend seminar, and I was hooked. Here were docs that were talking about, doing extensive testing, whether it be hormone testing or organic acid testing or toxin testing, neurotransmitter testing, environmental testing, things that just didn't even exist in the world that I had sort of grew up with in the medical scene. And I was like, wow, this group of people they're looking to see why people are not well. And it really resonated with me. And they had a fellowship program where you could go through many, many modules and learn the different sort of approaches to the different areas of the body, and put it all together in a complete wellness package. And so I went through that and became fellowship trained and board certified through A4M to practice functional medicine. And I did that alongside the aesthetic part of my career for quite a while longer. And then I moved out of aesthetics and more into functional medicine over time. And as part of another practice that I began to work with, I also got involved with hyperbaric medicine and became a certified hyperbaric doc and oversaw hyperbaric treatments for patients, looking at helping people with healing chronic wounds, especially people who are diabetic, helping people with sudden hearing loss, helping people with a lot of traumatic brain injury and dementia, and some other conditions that we would see. And so, mostly what I've kind of done for the last few years before going a little bit more consulting direction has been a combination of functional medicine and hyperbaric medicine. And that's how I got here.
It's quite a background, my friend. It's amazing. I had a little bit of a glitch on my part. I was sitting there scrambling. My screen went black. And I was going back and forth with the studio and say, just keep the doc talking a little bit, but you're great. Thank you. I appreciate that very much. Let's start talking a little bit about peptides and what they're really all about. And, peptides, if you will, are a group of amino acids, and they lead to other types of formations in the body. So take us through that. We all need peptides. So the thing I want to cover today is, are peptides a real deal thing? Because we see all these collagen support peptides. We see all these cosmetic peptides, things that are supposed to restore function across the board. What is a peptide in layman's term, and what is its basic purpose in the body, if you will?
Well, that's quite varied. So, when most people are talking about peptides in the medical and the athletic community, they're generally talking about a compound that is smaller than 40 or 50 amino acids. So, for the people who may even be wondering what that means, when you look at the label on a protein shake, on the back of that label, it'll have a bunch of different amino acids: glutamine, methionine, cysteine, lysine, valine, things like that. Each one of those is an amino acid. And when you string amino acids together, depending on which amino acids you are using and what that string, what's the order of that string, as you build that peptide, each one is going to have different functions. And so you can imagine, with all the permutations, when you go from just 2 amino acids connecting, there's only, one way you can do that. But once you add a third and a fourth and a fifth and up to 40 or 50, each one of you have exponential growth in the different permutations that can occur with these peptides. And what they're basically doing is going through the body and turning on switches or turning off switches. They help regulate communication pathways between cells. They help regulate how the body sort of looks at its DNA and does what we do, transcribes the RNA out of DNA, and those RNAs then, give direction to the cell of, do this, don't do that, increase this, decrease that, open up the pores so that we can let things in, close things down so we can keep things out. That's basically, what peptides are doing. They're really, improving and directing and controlling communication throughout the entire body. And, there's some people that say, oh, peptides are unsafe, or, there's just not much known about them. Well, insulin is a peptide, and we certainly use plenty of insulin throughout this country every day. Penicillin is a peptide. And, right now, a very, very popular peptide on the market is, I call it semaglutide, but everybody else says semaglutide or Ozempic or Wegovy. Those things they're all peptides. So there's many, many examples of them.
So question. Now, we know that peptides are chains of amino acids, if you will, up to a certain point, and then they become something else. And the literature says that once they get to be about accumulation about 50 peptides, 50, they turn into a protein structure. And we know that proteins are what the body uses to repair, restore, trigger, and so forth. So do they have to become that proteinous substance first before they work in combination with other things, or do they work on their own as a peptide? Because what I heard you say initially, and I'm doing this for our audience, is that they're gatekeepers, they're directors, they're switches that turn things off and on. When do they become an initiator?
Yeah, I mean, well,
does that make sense?
So they don't need the proteins to work. In fact, typically what's going on is the peptides are making signaling and communicating to the cells, or, use this section of DNA to make this protein, or back off on making this other protein, depending on, what the function of the peptide is. So generally they're affecting the cells, basically what the cell wants to be doing. They're affecting the different proteins that cell could make to do the things that it needs to do. So it's generally the peptides are initiating the process to make more or less of a protein. Once the protein is there, now it generally has its own function, usually structural, where, now the protein's going to work and to do what it needs to do.
Well, let's talk about, I treat a lot of athletes, and many of them now are taking all kinds of things from back in the day, creatine rather, and then they started adding HMD for muscle repair, recovery, and expansion, and now peptides, right? And the combination of many of those things. So they're going out and picking up all these collagen proteins, these collagen peptides, and is it the peptide within this matrix that is working, or how does that work? Because that's where the confusion comes in with so many people. Because I look at them and I say, look, you have a product that you have to be sure that is extremely clean. So in those products, are they adding the peptide to it to direct it more to the muscle pattern and the expansion pattern of what they're saying the protein's for, or is it doing another
well,
job?
the thing about a lot of the pleiotropics, or a lot of the peptides, is they're pleiotropic in nature, meaning they can do all sorts of different things. So, it kind of depends on which peptide you're talking about. Often when you're talking about like sports products, the powders and the drinks, and let's say, well, they've got these amino acids or these peptides, often those aren't the things that you add to those kind of products. They're not the signaling cellular control type of peptides that we're talking about today. Those are things that, if you take a protein, many people can't digest a full protein, whether it's a collagen protein or a beef protein or a pea protein. There's people that don't digest that very well. So they'll break them down, they'll hydrolyze them and break them down into peptides, which are smaller and much easier for people to be able to absorb through their GI tract. And then those can be used as raw materials by the body to make proteins. But when you see peptides in that kind of a situation, it's not the sort of cellular signaling thing that we're talking about with the more, I don't know what you want to say, medicinal kind of peptide.
Yeah, got it. So you've seen a lot of different, you go to manufacturers, you see a lot of different peptide advertising. And without getting into the biochemistry, which would be a great conversation to have depending on our audience, are the manufacturers designing their own peptides and using that for specific conditions, or are they extracting them? How's the peptide produced? Basically is the question. And is there natural peptide formations opposed to
most
engineered
definitely
peptides?
Both. So a lot of peptides that are synthesized or manufactured, they're often synthesized from a natural peptide. So let's say there's one called thymosin alpha 1, which has a lot of immune regulating capabilities. It helps calm down overactive T cells, helps with excessive lymphocytes, and actually was found to be very helpful in reducing mortality amongst COVID patients with severe COVID-19. And that's just pulled right out of the thymus gland in the body. We make it completely. There's another one called BPC 157 that's derived from gastric juice. Generally, the BP 157 is modified slightly, but it's very, very, very close to the product that we have in our own gastric juice. So there's plenty of peptides that are natural. We make them ourselves.
So the question becomes, is this? So they're extracts. Where are the extracts coming from? Which animal are they taking from?
A lot of that stuff is not really common knowledge on where they're getting it from. I've seen some places that are taking it from bovine sources. I've seen places that are taking it from, sheep, things like that. But a lot of places won't talk about it. And that is one of the downsides with the industry. But the thing is, most of the synthetic ones, and even the ones that are natural, like a thymosin alpha 1, those are reverse engineered. And, generally companies from the reverse engineering they don't need to be able to extract it from another source. Once they've got the amino acid sequence, it's pretty easy for them to rebuild it in a lab, and it's the exact same thing.
So the question that begets the next question: are peptides dangerous?
Well, if they're used too heavily, there's possibility of adverse effects. Although peptides in general are pretty safe. You've got to inject them at levels that are much, much higher than are recommended to have side effects. One of the exceptions to that is there's a pretty popular peptide known as PT141, and it's derived from another peptide called melanotan 2, and it's used for libido for both men and women, and it's different from things like Viagra or Cialis that work on opening up blood vessels. This actually works on the central nervous system to increase the actual desire.
So then it would have to have an effect on dopamine formation in the body, because that's what the driver is.
And it's again one of many effects. But one of the things that is a side effect of that particular peptide is nausea, and some people can have just a crippling nausea with that, even at low doses, and they just can't use it. And other people, they have a little bit, or they have none at all, and they're fine with it. But as far as side effects for peptides, as far as any of the peptides that I've dealt with, that's about as bad as I've seen. I can say after years of using peptides in various situations with many different patients, knock on wood, I have not seen any kind of significant side effect. Probably one of the most significant side effect profiles I've seen for a peptide is actually with semaglutide, the Ozempic and the Wegovy that are being used now. That peptide, again, we're talking about, where are peptides created or extracted from. That peptide originally was extracted from the Gila monster. So they took the venom of the Gila monster lizard, and they worked with that. That, I think, work started on that back in 1985, when a scientist saw the effect that that venom had on blood sugar, and he decided, you know what, I want to work with this a little bit more. So acquired himself a Gila monster and started working with that venom, and over time made it into the GLP-1 agonist that it is now. So because of, you're probably not going to find people saying because of, I believe one of the reasons why it has the side effect profile that it does is it's derived from that venom. So, and one of the things that venom can do is it can paralyze the gastrointestinal tract. Our GI system is always, it has what we call peristalsis. It's always kind of moving to keep things going through. And, that kind of keeps the natural order of things going, and we eliminate like we're supposed to. But you could imagine if you introduce something that happens to work in a way where it paralyzes that GI system, nothing's going anywhere, and you're not going to feel very good pretty quickly. So nausea and vomiting are a pretty common side effect. Now, they say that that's pretty short-lived and most people get used to it. I can't speak to it myself. I haven't used it with patients myself. So I don't have personal experience where I could say I had X amount of patients and these people got nausea. I don't know. I've seen it in other people and other people's practices, and other actually friends that I know that have had issues with rashes or nausea and vomiting. Generally if they're pulled off of the drug and they wait a little while and then they go in at a lower dose, they'll tolerate it. But when we talk about side effects, that's from the peptides that I know that are used sort of in the medicinal and performance world. That's about the worst I've seen.
Yeah. So question, you brought up Ozempic, and obviously, it's a new drug on the market. They advertise the hell out of it. All you got to do is turn on television, listen to the radio, look at a journal, whatever, it's all there. But Ozempic is a dual medication. One, there's an immune suppressor action within it, but also the peptide formation. One doesn't resolve the responsibility of the immune suppression. And what's your feeling about the combination of those drugs? Again, it's an opinion that, and I don't expect you to say this is an absolute, but you're a bright guy. You get it. What's your thought?
All I can say there is, I have seen a good amount of the people that I know who are on Ozempic in the time frame that they are on it. I've seen them get sick more often. So people who, maybe they got a cold once a year, in a 6-month span of using Ozempic, they got sick like 4 or 5 times. So I think there's a reality there that I can't speak to it much more than that.
Yeah, it just seems that most of the drugs that we see on the market right now are either straight up immune suppressors or they're combined with other things. And sometimes the combinations are producing side effects, if you will, or results that were not expected and so forth. But the area of peptides are going to grow exponentially, particularly in athletes, particularly in people who want to try some sort of restorative something. Stem cells and human expansive tissue are out there. There's a research facility in Panama called the Stem Cell Institute of Panama City that they're doing tremendous amount of research in many different areas. So we're interested because our patient base is interested. And we want to make sure that people get the right information and that they can do their own homework, if you will, and get comfortable, but also talk to people who really have a good knowledge base and understand what can be done. And as they don't become the guinea pig. Doc, I really appreciate you. You know that. And, I love talking to you because you bring a different perspective. You also keep my head, kind of wired straight instead of my going off into one end of the world, and you kind of bring me back on a good occasion. But I appreciate your time, man. Thank you very, very much. And we're going to do this again. We're going to dig into some topics a little deeper. I appreciate you very much.
Thank you very much. It's always good to talk to you.
Always good to talk to you. This is fun. When you have people who really know their stuff and really get it, but also understand my world and the things that we want you to know about and be able to apply properly with knowledge, with information. You should never do anything that you're told to do without understanding both sides of the puzzle. And that's why we're here. We want you to make sure that you understand it, that you get it, that you're able to apply it, and be able to, to move forward with your life, understanding that truly your outcome is in your hands. Anything that you want to get done, anything that, that you want to try to improve is about you understanding, not having somebody who wears a white coat tell you this is the way it needs to get done. So having said that, we got another great show for you coming up next week. And remember, we do this ongoingly for one reason. I love you all. Have a great day.